If you feel run down and fatigued chronically, there's a possibility that you're experiencing some level of adrenal fatigue, which may precipitate or include hypothyroidism. Chances are your mainstream doctor won't isolate adrenal fatigue as your main issue. Mainstream medicine only recognizes the extreme levels of exhausted adrenals, known as Addison's disease. However, there's many shades of grey, or non-Addison's hypoadrenia, before the extremely rare blackness of Addison's appears. Addison's disease is also called adrenal insufficiency. It's an uncommon disorder, and it occurs when your body doesn't produce enough of certain hormones. In Addison's disease, your adrenal glands, located just above your kidneys, produce too little cortisol and often too little aldosterone. Addison's disease occurs in all age groups and both sexes, and it can be life-threatening. Treatment involves taking hormones to replace those that are missing. Addison's disease symptoms usually develop slowly, often over several months. Often the disease progresses so slowly that symptoms are ignored until stress, such as an illness or an injury, occurs and makes the symptoms much worse. The symptoms can include extreme fatigue, weight loss and decreased appetite, darkening of your skin, known as hyperpigmentation, low blood pressure, even fainting, salt craving, low blood sugar, known as hypoglycemia, nausea, diarrhea and vomiting, and other gastrointestinal symptoms, abdominal pain, muscle or joint pain, irritability, depression or other behavioral symptoms, and body hair loss or sexual dysfunction in women. Addison's disease is caused by damage to your adrenal glands, resulting in not enough of the hormone cortisol, and often not enough aldosterone. Your adrenal glands are part of your endocrine system. They produce hormones that give instructions to virtually every organ and tissue in the body. Your adrenal glands are composed of two sections: the interior medulla, which produces adrenaline-like hormones, and the outer layer, the cortex, which produces a group of hormones called corticosteroids. Corticosteroids include glucocorticoids. These hormones, which include cortisol, influence your body's ability to convert food into energy. They play a role in your immune system's inflammatory response, and they help your body respond to stress. Mineral corticoids. These hormones, which include aldosterone, they maintain your body's balance of sodium and potassium and keep your blood pressure normal. And androgens. These male sex hormones are produced in small amounts by the adrenal glands in both men and women. They cause sexual development in men, and they influence muscle mass, sex drive, and a sense of well-being in both men and women. When the cortex is damaged and it doesn't produce enough adrenocortical hormones, the condition is called primary adrenal insufficiency. This is most commonly the result of the body attacking itself by an autoimmune disease. For unknown reasons, your immune system views the adrenal cortex as foreign, something to attack, and it destroys it. People with Addison's disease are more likely than others to have other autoimmune diseases also. The pituitary gland makes a hormone called adrenocorticotropic hormone, or ACTH. This in turn stimulates the adrenal cortex to produce its hormones. Benign pituitary tumors, inflammation, and prior pituitary surgery are common causes of not producing enough pituitary hormone. Too little ACTH can lead to too little of the glucocorticoids and androgens that are normally produced by your adrenal glands. Even though your adrenal glands themselves aren't damaged, this is called a secondary adrenal insufficiency. Dehydroepiandrosterone, DHEA, and DHEA sulfate are adrenal precursors of steroid biosynthesis, and they're centrally acting neurosteroids. Glucocorticoid and mineral corticoid deficiencies in Addison's disease require lifelong hormone replacement, but the associated failure of the DHEA synthesis is not corrected. In a randomized, double-blind study where 39 patients with Addison's disease received either 50 mg of oral DHEA for 12 weeks or a placebo, exhibited their levels going from subnormal to within the adult physiological range during the trial. Total testosterone increased from subnormal to low normal, with a fall in serum sex hormone binding globulin in the females, but with no change in either parameters in the males. In both sexes, psychological assessment showed a significant enhancement of self-esteem, with a tendency for improved overall well-being. Mood and fatigue also improved significantly, with benefit being evident in the evenings. No effect on cognitive or sexual function, body composition, lipids, or bone mineral density was observed. The results indicate that DHEA replacement corrected the steroid deficiency effectively, and it improved some aspects of the psychological function. Beneficial effects in males, independent of the circulating testosterone levels, suggest that it may act directly on the central nervous system rather than by augmenting peripheral androgen biosynthesis. These positive effects, in the absence of significant adverse events, suggest there's a role for DHEA replacement therapy in the treatment of Addison's disease. Common doses of the two precursor prohormones are 50 to 100 mg per day of DHEA and 50 to 100 mg of pregnenolone. Your body uses cholesterol to produce DHEA, pregnenolone, and all other hormones. Before supplementing with DHEA or pregnenolone, you should have a blood test to first assess your levels. People with Addison's disease often have an underactive thyroid gland, or hypothyroidism, where the thyroid gland doesn't produce enough hormones. By testing the levels of certain hormones in your blood, your endocrinologist can determine whether you have hypothyroidism. Be sure to check out my video on treating hypothyroidism naturally. Some supplements that are used are tyrosine, nascent iodine, selenium, removing any mercury dental fillings, taking bladder wrack seaweed, etc. Check your morning body temperature. This may give you a good estimate of your thyroid function. It may be even more reliable an indicator of a thyroid problem than a blood test that assesses T3, T4 conversion. Stressful stimuli, whether emotional or physical, cause the hypothalamus to activate the adrenal medulla via a sympathetic nerve impulse and the adrenal cortex via hormonal signals. The medulla mediates the short-term responses to stress by secreting catecholamines. The cortex controls more prolonged responses by secreting its steroid hormones. In the short-term stress response, the hypothalamus sends nerve impulses to the spinal cord. Preganglionic sympathetic fibers innervate the adrenal medulla and they release catecholamines with the following effects. They increase heart rate, increase blood pressure. There's hepatic conversion of glycogen to glucose and the release of glucose into the blood. There's dilation of the bronchioles and changes in blood flow patterns, leading to increased alertness, decreased digestive system activity, and reduced urine output. In a long-term stress response, the hypothalamus releases corticotropin-releasing hormone to the corticotrope cells of the anterior pituitary. In response, the anterior pituitary releases adrenocorticotropic hormone. This leads directly through the blood to the adrenal cortex, stimulating and releasing mineral corticoids and glucocorticoids. Identifying sources of inflammation. Treatment is very tricky for each diagnosed autoimmune disease. An underlying theme to autoimmune disease is inflammation. Thus, treating inflammation alongside appropriate medical care is imperative. Just as traditional treatments are specific to the diagnosed disease, so is the treatment of inflammation. Is there something specific that's causing or exacerbating one's inflammation, such as a food sensitivity? These are typically immunoglobulin G mediated allergic reactions. Most commonly, this elicits a delayed hypersensitivity reaction, which can be associated with arthritis, autoimmune disease, eczema, migraines, gastrointestinal complaints, and many other chronic symptoms. After repeated exposure to offending foods, the immunoglobulin G specific antibody level increases. Over time, these antibodies can result in excessive food antigen antibody complexes that can tax the immune system every time one ingests a specific food. Other possible sources of inflammation include chronically elevated cortisol, sometimes seen in early stage Addison, and insulin, heavy metal, and other toxic burden, specific foods high in inflammatory prostaglandins, and unnecessary body fat. A person with autoimmune disease is already under a great deal of stress. The strain of an external affliction will only further burden the body. As well as trying to determine and remove sensitive trigger foods from the diet, you can also adopt an anti-inflammatory diet. You can also use enzymatically preserved colostrum and the amino acid L-glutamine to help to treat a leaky gut, as a leaky gut increases the amount of inflammatory toxins being absorbed into the body. There's numerous anti-inflammatory herbs and supplements which may also be beneficial. Some of these are curcumin from turmeric, boswellia, which is known as Indian frankincense, astaxanthin, cat's claw, St. John's wort, etc. You could check out my video on arthritis for a list of anti-inflammatory herbs with their common doses. Sugar consumptions in all forms, including glucose, fructose, and sucrose, will impair the ability of white blood cells to destroy biological agents. This effect begins within half an hour of consumption and it lasts for 5 hours. After 2 hours, immune function is reduced by 50%, a rather alarming statistic. Other foods to minimize are caffeine, as this puts the adrenals into that sympathetic nervous system mode. Junk foods, processed foods, or foods that are low in nutrients and high in calories. Also minimize foods with preservatives and colorings, trans fats, fast food, artificial sweeteners, refined grains, and foods from the nightshade family. The alkaloids found in common nightshade vegetables are powerful, with potential adverse effects on various tissues, including the membranes of the cells of the body. They bioaccumulate, meaning they remain unprocessed by the body and simply accumulate in the tissues. So what can you eat? Lean proteins, including beans and legumes, fish, lean poultry, and eggs. Organic or cage-free versions are a smart choice, as this reduces pesticide exposure. Adequate protein in the diet is important to maintain balanced blood sugar levels, which helps to keep appropriate cortisol levels in the bloodstream. Grains, legumes, nuts, and seeds are a fantastic way to supplement the diet. And don't forget that fruits and vegetables are also rich in phytonutrients. Nutrition is imperative in everyone and should be monitored specifically in a patient who's diagnosed with adrenal fatigue or Addison's disease. B vitamins and vitamin C serve as fuel for the adrenal glands. Make sure that you get a good quality multi-B vitamin with B12 in the form of methylcobalamin. The best form of vitamin C would be liposomal vitamin C. You can see my video on how to make this easily in an ultrasonic cleaner. After this, the next best form would be a non-acidic, pH-buffered vitamin C, with the worst kind being cheap, acidic ascorbic acid. By consuming flavonoids such as quercetin, it can enhance your vitamin C. Addison's anemia is a blood disorder caused by a lack of B12. Patients who have this disorder do not produce the substance in their stomach that allows the body to absorb B12. This substance is called intrinsic factor. You might also want to take a separate B12 5000 microgram in the form of methylcobalamin as well as a multi-B vitamin. Realize that a B12 blood test might not detect a deficiency, as food is now fortified with folate, and this can give a false reading on the test. Fatty acids, specifically phosphatidylserine, are important to nurture the adrenals and to quiet them down at night if they're overactive. Like phosphatidylserine, the herb tulsi, also known as holy basil, can be taken as a tea, and this also helps to regulate the cortisol response. Adaptogens are herbs that are considered to have a normalizing effect on all systems in the body. Consider adaptogenic herbs like ashwagandha, rhodiola rosea, or licorice root, Eleutherococcus ginseng, Panax ginseng, and schisandra. Check out my other video on chronic fatigue and on fibromyalgia for more possible solutions. Coenzyme Q10 comes in the form of ubiquinone or ubiquinol. It's essential for cellular energy production. It has antioxidant properties and it protects cell membranes from damage. It's also commonly taken as an anti-aging supplement and to increase endurance in athletes. When coenzyme Q10 is utilized as an antioxidant within the body, its availability for energy production may decrease. This is the rationale behind the dietary replenishment of the CoQ10 in many disease conditions. Preliminary data suggests that adrenal hormone secretion is related to coenzyme Q10 levels. Analysis of coenzyme Q10 levels in people with irregular pituitary adrenal axis function showed that coenzyme Q10 levels are considerably lower in people with isolated decreases in the adrenal function when compared to people with adrenal hyperplasia or multiple pituitary deficiencies. The ubiquinol form of coenzyme Q10 has been shown to absorb better in the bloodstream than ubiquinone. Doses of ubiquinol, CoQ10, range from 200 to 400 milligrams per day. Its mitochondrial boosting effect can be enhanced when it's taken with PQQ in a dose of 20 to 40 milligrams per day. Be sure to check out my other video on mitochondrial boosters for more supplements that can help here. Make sure to have your vitamin D levels above normal. Stress causes excess cortisol to negatively affect the vitamin D absorption. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. MTHFR gene polymorphisms are related to adrenal burnout and to chronic fatigue, as well as how you get your energy back. One common tie between all causes of fatigue is involvement of the adrenal glands, the part of our bodies that respond to stress of all types, making cortisol and adrenaline, and methylation, which is the way our bodies use B vitamins. However, often adrenal function and methylation are not addressed by practitioners. Several processes that could result in fatigue are reliant on healthy methylation. Methylation is needed to produce SAM, or S-adenosyl methionine, which is used to create and eliminate adrenaline. When someone with an MTHFR mutation is not getting enough methylfolate, they could have higher or lower adrenaline, as in norepinephrine or epinephrine levels, and this can result in fatigue. The enzymes that make and break down serotonin and dopamine also require methylation and SAM to work well. So imbalanced serotonin and or dopamine levels can result from not having enough methylfolate. Both of these situations can affect your mood and your energy levels. At the same time, histamine levels can increase when you don't have enough SAM, making you more susceptible to allergic responses, which can cause fatigue. But as soon as we support the methylation in the right way, all of these systems can improve. You can start by trying a low dose of methylfolate, 400 to 1000 micrograms, once every 3 days. It's recommended taking the methylfolate with methylcobalamin B12 because your body uses both of them together. If you're feeling foggy due to chronic fatigue, you could try many brain-boosting herbs and supplements to improve your cognitive ability. By improving your focus, it can help to reduce stress and speed up your recovery. You can check out my videos on brain-boosting herbs, on nootropics like Noopept and the racetams, my videos on mitochondria boosters, and my video on choline sources. Regulating sleep can help to reduce stress. You can take melatonin before bed to help sleep, or check out my other video on herbs that'll help you sleep. You should avoid any stimulants that weaken the adrenals like caffeine or yohimbine. You can optimize your thyroid function in the day with bladderwrack seaweed, nascent iodine, and the research chemical SR9009 to help with energy in the day and resynchronizing the circadian rhythms. The mineral magnesium is part of the energy mechanism that keeps cells running smoothly and prevents adrenal fatigue. Magnesium is a catalyst for more than 200 chemical reactions in the human body. The energy centers in your cells, including those in the adrenal glands, need magnesium for the optimal operation. Most people are deficient in magnesium, and many dietary choices can worsen this deficiency, such as a high carbohydrate diet or the consumption of prescription drugs. The best form of magnesium would be magnesium bisglycinate. To determine your dose, slowly increase until stomach discomfort or diarrhea is noticed. Then gradually decrease the dose until you determine your maximum tolerable daily amount. As magnesium contributes to many functions in the body, it can have profound benefits over time. Another supplement that can work synergistically with magnesium by its ability to activate over 100 enzymes in the body is zinc. Ensure that you get 30 to 50 milligrams of zinc in a highly absorbable form, as many types of zinc have low bioavailability. Prevention is better than cure, and less medication whenever possible is always advised. Try to improve your sleep. Try an antioxidant-rich, anti-inflammatory alkaline diet. Ensure that you get precursors like cholesterol, DHEA, pregnenolone, and nascent iodine. Ensure that you correct nutrient deficiencies and take trace minerals, and also a multi-B vitamin and a B12. Check out my other videos on thyroid function, chronic fatigue, fibromyalgia, herbs for sleep, and mitochondria boosters. Reduce stress with adaptogens. Improve your stress-fighting ability with brain-boosting herbs, nootropics, and choline. And restore your energy production with mitochondrial boosters.